Ever found yourself sneezing uncontrollably during allergy season? Or maybe you've had an itchy rash that just wouldn't quit. If so, you've probably reached for an antihistamine. They're lifesavers for so many of us, helping to block the effects of histamine, that pesky chemical our bodies release during an allergic reaction. From hay fever and hives to bug bites and even motion sickness, antihistamines are the go-to solution. They come in all sorts of forms: pills, liquids, nasal sprays, and eye drops, and many are available right over the counter. They seem like a simple fix, right? But have you ever stopped to think about what else they might be doing to your body? While they're busy fighting off your allergy symptoms, antihistamines can also bring a few uninvited guests to the party. The most famous one? Drowsiness. This is especially true for the older, first-generation antihistamines. You might know them by names like diphenhydramine or chlorpheniramine. They're super effective, but they can make you feel like you need a nap, which isn't great if you have to drive, operate machinery, or just stay awake in an important meeting. This happens because these older antihistamines can cross the blood-brain barrier, affecting your central nervous system and making you feel sleepy. So, if a package says non-drowsy, it's usually referring to a newer, second-generation antihistamine that's less likely to cross that barrier. But sleepiness isn't the only side effect. Have you ever taken an antihistamine and suddenly felt like your mouth was as dry as a desert? That's another common one. This happens because antihistamines can reduce saliva production. You might also experience dry eyes or even a dry nose. While it's usually just a minor annoyance, persistent dry mouth can actually lead to other issues like bad breath or even an increased risk of cavities over time. So if you're taking antihistamines regularly, it's a good idea to stay extra hydrated, maybe chew some sugar-free gum, or use moisturizing mouth sprays to keep things comfortable. It's a small step that can make a big difference. Let's talk about headaches and dizziness. These can be a bit more unsettling. Some people find that taking an antihistamine, especially for the first time, can leave them feeling a little lightheaded or with a dull headache. This is often your body just getting used to the medication. The dizziness can be linked to the same mechanism that causes drowsiness as the medication affects your central nervous system. In most cases, these feelings are temporary and might go away as your body adjusts. However, if you feel severely dizzy, or if the headache is intense and doesn't go away, that's your cue to stop taking the medication and have a chat with your doctor or pharmacist. It's always better to be safe. So, how can you use antihistamines safely and effectively while minimizing these side effects? First, always read the label. It sounds simple, but it's the most important step. The label will tell you the correct dose, how often to take it, and what potential side effects to watch out for. Second, consider the timing. If you're taking a drowsy formula, it's best to take it at night before bed. For daytime relief, opt for a non-drowsy second-generation antihistamine. Third, be mindful of what else you're taking. Alcohol can seriously amplify the drowsiness caused by antihistamines, so it's best to avoid it. The same goes for other medications that cause sleepiness, like sedatives or sleep aids. Mixing them can be dangerous. And finally, listen to your body. Everyone reacts differently to medication,